Alrighty, welcome to another article that I'm going to just review for you on camera that I've written for the website. So this one is OSTEO, PHYSIO or CHIRO, and what is the secret truth behind choosing the right health professional for you? And this is based off a presentation that I whipped up to deliver to a group of different corporate companies. So to give you a bit of an idea of the stuff that we're going to talk about. So what are the similarities between the professions in terms of qualifications, educations? Do they all have different underlying philosophies or principles that they practice with? What's the real difference? What makes a good professional or practitioner, in my opinion, I guess, and how to go about choosing the right one for you. So in the article, you'll see a picture, a reference from 2019 that sort of shows you through how many different professionals are registered for each one. So obviously physio is the biggest one with roughly around 37,000 practitioners registered as of today. Quick little note about osteopathy though, it is the fastest growing health profession with an average increase of around 7% every single year compared to the other professions in the industry of around 3%. So that's a little fun fact for you. Now, if some of these professions, we're going to focus mainly on the big three being physiotherapy, osteopathy, and chiropractic. So we're going to do a quick little brief overview into some of the backgrounds of these different professions, just in case these are something that you've never encountered. So I just pulled these off one of the governing body websites. Physiotherapists are the experts in the structure of the human body and its movement. They work with people all ages to treat a broad range of health conditions, including sports injuries, musculoskeletal conditions, as well as chronic health conditions such as diabetes, obesity, osteoarthritis, and stroke. Physiotherapists are involved in the assessment, diagnosis, planning, and management of patient care. A chiropractor diagnoses and offers treatment for back pain and disorders of the musculoskeletal system. The treatment may include manipulation, massage, or ergonomic advice. And the final one, an osteopath has a clinical focus on the way the body works in strains or injuries in human movement. They provide direct manual therapy interventions, including exercise prescription, needling, education, and associated lifestyle advice to improve movement, reduce pain, and manage and/or treat a range of physical impairments. So let's go through what these three professions actually have in common. So they do have a few overlapping qualities. They're all registered and governed by APRA, which is the National Health Practitioner Agency. You don't need a GP referral to go and see any of these people because they are considered primary healthcare practitioners, meaning that they classify as the first point of contact for a variety of health complaints. And the reason behind that is that they are trained to recognize when further or emergency medical assistance is needed. Private health rebates can be used for all of these different professions, but it does depend on what your level of coverage is or which company you're covered by. And whilst differences do exist between different states, different universities, education, everything like that, they all have at least a minimum of 4 years of university education covering the topics like anatomy, physiology, biomechanics, etc. So different subjects might differ between the courses, but they all have at least a 4-year university degree. So what are the main differences between these professions? You'll notice I'm going to zip through this because this was actually roughly a 40-minute talk and I don't want this video to be that long. So what are the main differences? So we're going to do, again, a little quick brief overview on how traditionally these professions will practice or how they are normally, I think this is a pretty fair snapshot of how they're normally seen by the general public. So we have physiotherapists. Now they are the experts in exercise and rehabilitation, and they are widely considered the most evidence-based of the three professions. They don't typically have some sort of underlying philosophy, which means that occasionally they can be considered quite rigid or maybe even narrow-minded in their approach because they're often following quite strict guidelines based on what hopefully is the latest evidence. And they also receive very little hands-on or manual therapy training during their qualifications, which means that unless they've gone through additional courses or training, they're probably going to be pretty limited in this area. Now, as for chiropractors, they are the experts in spinal manipulation and will often be the first point of contact for people with back or neck pain. Their practice typically revolves around that style of treatment and unfortunately often includes people being referred for unnecessary scans and imaging. Typically have minimal training in exercise and rehab prescription unless, again, they've undergone additional training post-degree. And unfortunately for chiropractors, their underlying subluxation philosophy which underpins most of their treatment style and their treatment justifications, where they state that spinal misalignments are the cause of many different forms of disease. That's actually been debunked by science over the past few decades. Now, osteopaths, I'm trying to not be biased here, as I think you'll see, they are the experts in thinking holistically, which is heavily rooted in the underpinning philosophy that the body is a unit and no system operates in isolation. Typically very hands-on or manual therapy based with limited knowledge of exercise and rehabilitation. And this outside the box or slightly left of center approach can sometimes, which I've experienced, lead osteopaths to be seen as a little bit alternative or out there or not aligned with the more traditional and evidence-based approaches to medicine. So essentially, to sum up how the general public probably sees these people is physio gives me exercises, chiro cracks my back, osteopath does a little bit of everything but doesn't really do anything in particular. And that's because the physio and the chiro professions appear to be attached to something that they do, like their treatment styles, while the osteos are normally or typically a bit more attached to the way that they think, being their holistic approach. And maybe that's why, I'm just speculating, but maybe that's why osteopaths are typically a little bit less known, because it's easier, at least from a marketing perspective, to advertise or describe the things that you do rather than the way that you think. So let's talk about the real differences between these professions, because the assumption has always been that these professions are all very different with different techniques and different skill sets. But the reality is that the real difference comes between the practitioners, not the professions. Because the truth is that we are all a bit more alike than some would like to admit. So it's important to note that osteo and physio and chiro, they're just titles. They don't describe a specific treatment or a specific treatment style. Each profession is qualified to diagnose, manage, treat, and help prevent musculoskeletal conditions. You might go and see an osteo, you might go and see a physio, you might go and see a chiropractor, but you don't go and get a osteo treatment. That doesn't describe what is happening within that session. Because in the modern age of evidence-informed medicine, you're going to start noticing that the best practitioners practice in a very similar way, because the secret is out now that gone are the days where a 5 to 10 minute appointment for a quick adjustment or a spinal manip or throwing some needles in and then just leaving you there for 10 minutes, taking them out. Gone are the days where that is considered even not optimal, but gone are the days where that is even an acceptable approach to healthcare now. We deserve better and we expect better. Now, with ongoing access to further education, physios can crack backs, osteos can work in a professional sporting environment, and chiros can give you some of the best exercise rehab that you will ever receive, if they want to, because it is well within their scope of practice if they've gone and they've undergone additional training to provide you with these things. And that's not to say that every single practitioner works this way. Some clinics, some professions like to stick with their more traditional approaches that match up with how a lot of people see those professions, and that's completely fine. But the reality is that the lines between these professions are getting more blurred every single year. So my advice to you is this: choose the practitioner, not the profession. because the person's title no longer really tells you much about how they practice or what sort of clinician or treatment that you're in for. Now let's quickly talk about, again, in my opinion, what makes a great practitioner. Because you're probably sitting there and you're probably thinking, well, geez, that's great, Matt, but I still don't know how to pick a good person. Now you've basically told me that they're all the same. So my pool has now gone from choosing what I thought was one profession to now choosing between anyone in any profession. So you've basically just given me way too many options and now I'm overburdened. So I want to make it clear how to go about finding what is a good practitioner in 2023. Here are a couple of characteristics. First of all, they listen, they acknowledge, they empathize, they reassure you, they build up confidence, they don't build up fear, because you should never walk out of a session with somebody feeling more broken than when you walked in. One of my mentors, Craig Liebenson, he's a US-based chiropractor, says, the job of the clinician is to give people tangible hope and an achievable plan. And that is his tagline for his business, LA Sport and Spine, which is amazing. Because you're already most likely in pain. You're already more worried about what that means. And our job as health practitioners is not to just stack on even more burden on top of that. We're meant to reassure you and build you back up. Now, some other qualities of a good health practitioner is they encourage you to ask questions, make sure you're involved in the decision-making process, and they focus on getting you off the table and back to doing the things that you enjoy, that you love, that you told them that you want to get back to doing. Now, quickly, I've got 6 things that you can ask yourself to double check whether you think you're seeing the right health professional. If you have any doubts right now, I want you to stop. I want you to sit and think to yourself about these 6 questions and reflect on them. 1, have they actually asked you about your goals and what you want the outcome to be? 2, have they considered your overall health, social situation, and hobbies to create a treatment plan that's not just suited to your lifestyle, it's suited to your goals, it's suited to your availability, it's suited to you, the person? 3, are they educating you on the importance of self-managing your condition or your pain or your aches or your injury? 4, do they encourage you to participate in exercise and physical activity, or are they still stuck in that approach where they keep telling you all about the things that you can't do and they don't tell you anything about what you can do? 5, have they helped you come up with a plan of attack for future flare-ups? Or are you going to be stuck just needing to go and see these people every single time that something bad happens? And 6, are they actively working with you, or do they just work on you? Because if your practitioner is doing more work within a session than you are, I just don't think that's going to get you back to all of the things that you say that you want to be doing, okay? And I understand that that can be seen as a controversial statement. I know that people often come in for manual therapy, and obviously it's going to seem like they're doing more work than you are doing. And that is okay during the initial stages. But if that just keeps dragging on and on and on, and there is never a point where you're doing any of the work, you're never going to quite get on top of these things. And that links into some of the previous questions where we're talking about self-management. Managing flare-ups, all those sorts of things. You can't become reliant on these people to get you out of trouble, because that's not going to lead you to sustainable results or lasting success. Now, there are 3 ingredients, and we actually know this through science, but there are 3 ingredients that are linked with positive and successful clinical outcomes, and they are an internal locus of control, a growth mindset, and grit. If you have those 3 ingredients, you are more likely to have a successful outcome. And what that basically means is that you're more likely to succeed if you believe that you have some level of control over the problem, which improves your mindset. You might start seeing these challenges, or you might start seeing these obstacles as challenges rather than becoming overwhelmed by these things, feeling like they are completely out of your control. Now, grit is a little bit harder to describe because it's a combination of passion, think goals, motivation, and consistent direction or clarity, and perseverance. So think resilience and stick-to-itness. A lot of people get caught up in the promise of the quick fix or the quick fix mentality. And unfortunately, this leaves people pretty disappointed with the results, and it keeps them stuck in this vicious cycle of jumping from treatment to treatment, practitioner to practitioner, in the search of the one who actually delivers that quick fix that everyone seems to promise that they can give. Now, if the practitioner is promising to fix something, not only does that imply that something is wrong, because often a lot of normal things get over-medicalized, it puts them up on a pedestal, and it makes them the heroes coming to save the day. Now, remember the 3 secret ingredients of clinical success, all right? They are all within you. Feeling like you have a sense of control, the ability to look at obstacles as challenges, switch that mindset, and things like resilience, perseverance, grit, all of that comes from you, okay? So a great practitioner is aware that you are the hero, you are the Batman, we are the Alfred, we are guiding by the side, giving you the tools that you need to help you achieve the outcome that you've come to see us for. So let's talk about how you can actually find your Alfred. Okay, so there are 2 main things to touch on here: where to find them and how to make the final decision. So very quickly, where to find them. Even in the internet age, one of the best ways you can do, or one of the best ways you can go about this is word of mouth, right? Ask a family member, colleague, spouse, whatever. Ask them if they've had a good experience with a health professional before. Now, ideally, if you're comfortable to talk about what you're both seeing this person for, they were experiencing something similar to what you're going through, so then you know that obviously they went through the exact same thing, they've gone to see this person, they had a great outcome. You'll already know that this person's well equipped to handle what you're going in with. Google reviews as well. Now, all of these different services are actually, as part of being registered and regulated under APRA, you're going to find this very different than going and looking up your local cafe, because essentially these businesses aren't allowed to actively promote testimonials, which is why it can be a little bit harder to find some of these things online. But Google Review, because it's a third-party system, they actually can't delete these things. They don't have control over those. So whether it's good or bad, because it's out of their hands, they're okay. So you still can find Google Reviews useful. Other different options: community group pages, websites like Health Engine, HotDoc, or even just contacting your private health insurance and seeing if they have some preferred providers as well. That can be a pretty good option to just try and find some services that are around you. Now, how to pick the right one. This can again be as simple as word of mouth, Google reviews, checking their websites, checking their social media. By looking at their presence online, you can get a pretty good idea about their professionalism, their personality, get insights into their interests, their treatment styles, and maybe even these people have actually released a heap of free information that is completely relevant to what you're going through. And in which case, that might be just the thing that you need. You might be able to log onto their website and find all of the details that you actually need before you even see this person. So do a little bit of research if you have the time. Some other things to think about as well might be appointment lengths. Are they stuck with really short appointments, 5-10 minutes? Do they have appointments that are long enough to actually develop a relationship and get to the bottom of what's going on with you? Or are they trying to bring you straight in, straight out, and it's just a bit of a transactional process? Do they have availabilities when suits you? Obviously, that sounds pretty straightforward. As well as things like appointment costs. Now, this is just a quick general rule. Do not base your decision on who you are seeing based strictly off price, because you typically get what you pay for. And if you're just trying to hunt for the lowest price around you, you're probably going to be able to find the lowest possible service around you, okay? Now, if you do need help making a decision, if you're struggling, if you're sitting there and you're still struggling to find out, okay, well, which one is right for me, we are absolutely interested in talking to you and helping you figure that out. So we are we're conscious of the fact that we are not a perfect fit for everyone. We don't want to convince people to come and see us if we know that we're not a good match, because it just leaves a bad taste in both of our mouths. There's no advantage to us doing that whatsoever, but we do love making sure that people are getting to the right service, the one that will help them get to where they want. So if you want to book a free call with us, we just ask you to fill out a quick little form so we can get an understanding of where you're at. We jump on the call, we discuss all of these things, and then we help point you in the right directions. Now, if we do think that we are the right service for you, we're happy to chat about what that looks like. If we don't think that we will be a good match, we're happy to point you in the right direction.